All right. Tony and I are going to be recording a presentation for the final for our EHR Mobile Health Unit project. As a quick recap, we the purpose of our project was to create an EHR to help with some of uh, the shortcomings of St. Helena Mobile Health Unit's public community health outreach program. And we thought we would be able to solve some of their shortcomings through the use of an EHR app that we would implement in their care. Um, we came up with a few goals and objectives, which Tony is going to go over soon. We came up with methods and activities that we could use to reach our goals and overcome some of the limitations that we might be facing. We conducted a SWOT analysis um, to guide our planning process. We identified resources and constraints and made sure to find accreditation through HIPAA and through high tech and other state and local regulations. We conducted a gap analysis to ensure that we would be able to complete or to develop the EHR within these policies and within these guidelines. Came up with an action plan as well to make sure that we were compliant. All right. So moving on to the program evaluation portion after the midterm.
Okay, let's talk about the final project for mobile health units. From the midterm project that we did, try to propose the solution for the project that we come across the problem, the gap, and we try to solve the problem with introduce the app for mobile health unit service. So we talked about the needs of the population. So this is kind of recap to you. So the proposals that we offer is that we divide into like three goals. So the first one is like to increase public relations and patient communication. Um, Secondly, we really want to increase the tracking, improve the efficiency in tracking in the population that we serve. That resonate to increase the health outcomes. The third one is like provide accurate, reliable, culturally competent in health education. So from that three goals, we generate into like three objectives. The first one is to get 1%, approximately 1,370 individuals of the Napa County population to download the app within the first year of the launch. And secondly, we try to get like 90% follow-up participation of care in at-risk individuals. For example, people with the hypertension or diabetic issues. The third one is like make every health condition and medication information pamphlet available in Spanish, emphasized in another languages on the app when it launched in year 2025, 2026. So, with the slogan like mobile health unit, bring care anywhere with EHR, your health, our goal. So, from that, since the midterm, we're going to come to the evaluation process. So, regarding all the obstacles or challenge, strength and weakness, SWOT analysis about the possibility to launch the software. Let's say like we pass through that, pass through the HIPAA, pass through the high tech, the regulation. So we implementing the app to the target groups in this year. So let's get to the part that involve like program evaluation. Since like it's kind of hard to really find the actual figures to support statistical data to support this solution because it's totally like brand new, brand new idea that we come up with. So we might have to use the database that we have so far to support our judgment, the evaluation in this section. So let's go for the number one. So Levi going to talk about the increased public relation and patient communication. All right, Levi, your turn.
All right. So, as Tony's mentioned, the first goal is to increase public relations and patient communication through this EHR. And in order to reach this goal, we set a realistic objective for our first year, which is to get 1% of Napa County population to download the app within the first year of launch, and that would be about 1,370 people. 1% of the Napa County population is a realistic goal for the first year of launch, and doing so would allow us to get patient report and communication, um, being able to get a good amount of people to download the app and to interact with it would help us with patient report and communication for the mobile health unit's activities, and can be accomplished through this EHR. Um, One of the things that we decided to look into is finding anticipated obstacles. As we mentioned, this is going to be a hypothetical evaluation of how well we were able to perform and how well our program managed to meet its goals. And in order to do that, we thought that it would be important to also include realistic obstacles. And for this one, we were looking into it and we found that IT literacy um, would most likely be an obstacle that we would be facing. Um, we also mentioned this earlier in our SWOT analysis that one of the weaknesses of our EHR program would likely be IT literacy in our target population, which is mainly older adults, those who face language barriers, and those of lower socioeconomic backgrounds. All right, and with these obstacles, or this obstacle, we found and worked on an action plan to meet our goals and to overcome this obstacle. First of all, we plan to hand out leaflets during the weekly food drives, BP clinics, diabetes clinics, and other events that we go through. We would also post these leaflets in public community sectors such as schools, um, courthouses, um, just like mayor's office, and anywhere that with a bulletin that we can get approval to post our flyers at. Um, we were thinking that about 1,500 leaflets would be a good amount, as it is close to our goal of 1,370. We also plan on training English and Spanish speaking super users from among the population to participate in public mobile health unit events and advocate and educate the population on the use of the EHR app. So the use of super users is something that happens in the hospital whenever we're making a change or introducing a new device or policy where certain people are trained to be very good at these new changes, and their job is to circulate and to advocate for the new change, and we can apply that to the app. We are going to recruit people from the local population who are interested and believe in the EHR app and think that it is a good idea. Teach them how to use it really well so that they can help teach people during the BP clinics, food drives, and diabetes clinics, and everything and all the other events. So we plan on doing this over the course of 3 months or so, 3 times a month, which is about the number of time that we have the food drives, BP clinics, and diabetes clinics. We thought that this would be a realistic way to meet our goal because the mobile health unit already serves over 800 individuals annually, and the events would provide the perfect opportunity to foster participation in the EHR app. So if we did this during these events, we believe that it would be a great way for us to meet these goals. So after meeting our goal for this year, we would have to come up with a new one in order to progress in this in when we meet these objective rather, we would need a new objective for the next year in order to continue to meet this goal. And we thought a realistic way of progressing would be to get 2% of the population in the second year to download the app within the second year of launch without losing too many people or and without people deleting the app from disuse. We also hope to achieve 30% user feedback from clients through integrated questionnaires, AI chatbot interactions, and emails from all the app users. It's an app is useless unless it's actually being interacted with. So that's what our hope is for the second year after launch. All right, moving on to goal and objective number two.
Hi, back to Tony again. This part gonna be the second objective. So second objective, we aim to get like 90% of the follow-up of the participant, especially people who have like chronic disease, like hypertension, or else like diabetic, for example. So those people we gain the benefit of EHR. The apps that we provide, through the appointments and then health education that we provide during the app. Also, like another function we call telehealth. So that kind of like creates some kind of one-to-one or maybe like team like teaching to contact with the healthcare provider for the patient. Also like a team inside, the staff that we have, we can do like telehealth as well. Also, like we get the contact through the patient application, app registration. So we got those email, location, and cell phone. So it's way better than what we have right now from the current practice. So like that's the goal that we're gonna do with the apps, and also like we can get the evaluation with the digital surveys from those apps as well. So that's kind of promote the efficiency tracking, you know. We understand the obstacle and barriers, like Spanish speaker they prefer like face to face. So that's why we have a telehealth to help them, do face to face interaction real time. So we have the super users that we acquire, and we're gonna train them about the orientation about the apps, digital literacies, and also like the health literacy as well. Those super users are gonna be leader for their community and pass through the knowledge to their community, local communities. Those kind of like serve the purpose of like the preferable of the Spanish speaker. They prefer like face to face interaction, and they don't trust the government or like agencies doing this because like they fear they they have a problem with their status, and especially like immigrant, non-immigrant and immigrant status. And also like they have a belief in remedies, herbals. We use this like opportunity, the knowledge that they provide on the app to educate them, to understand the conflict between like medication and the herbals, the properties, and we have the super users and the local leader to train them, educate them as well. So I think that's the barriers that we have, the cultural incompetence. We care about it, so we try to create this like objective along with the line with the cultural, um, literacies. So on this program, we promote a patient empowerment to take care of themselves. What about it? I'm going to tell you the next one. So, thanks to the IT, thanks to the apps, we have a user-friendly app interface they can use with the low-end smartphone. We have the offline function. They can put the data, and then when it goes out to the area of the Wi-Fi, they can upload to the cloud. And Spanish speaking, enjoy the Spanish language elsewhere in the apps. And we have a wide assistant for a user who have a disabilities as well, and low literacy in English. Um, like I told you, we use the Levin's model to teach staff and then the local area to the core local workers to incorporate the app into their service. We believe that EHR will provide the quality of care and support the cost reduction in the long term. Another limitation is like funding. We still need funding. So the next year data, we're gonna aim for 95% of the follow up. And then we're going to use the data from 2025 to attract the investor. We're going to start a project called remote patient monitoring. Patient will upload the health records by themselves. Maybe we can join hand with the high technologies to provide a vital sign machine. Thank you.
All right, finally, for our last Goal and objective. We want to provide accurate, reliable, culturally competent health education. In order to achieve that in the first year, we want to make every health condition and med information pamphlet available in Spanish on the app when it launches in the first year. All of this information is already available in the hospital upon discharge and available to patients in general. We just want to be able to move that from the hospital records and make it available on the app as well. We found that Spanish speakers make up a significant portion of our target population, and we want to be able to provide competent care to people of who might struggle with a language barrier. Providing culturally competent materials enhances health literacy, improves patient understanding, and supports better health outcomes, aligning with the overall goal. This shouldn't be a too difficult of an obstacle to overcome. The main issue with this would be navigating the legal aspects of sharing the medical information with the app. In order to overcome that, we plan to secure proper licensing agreements with the information distributors and attempt to negotiate alternative rate agreements since the hospital already is commissioning the use of these translated products. In the next year, we hope to incorporate audio and video explanations in Spanish for at least 50% of health conditions and medical pamphlets by the end of the year. Audio and visual video explanations for health conditions are often already available in English, and we're hoping to do the same with the Spanish-speaking populations to enhance their healthcare literacy and to bridge the gap in healthcare outcomes between English and non-English speaking patients. And that concludes our presentation. Thank you. And here are our references.